Take a minute. Okay, here we are. Welcome. I'm Dr. Rebecca Jorgensen, and welcome to this session of Talk Time, where I am joined with certified sex therapist, Sari Cooper. Sari, welcome.
Hi. Glad to be here.
Very exciting to have you here with us today, and especially on this topic where we're talking more and more about to relationship therapists to be able to help people a little bit more with sexual concerns. And that's certainly been a big topic that I'm addressing all the time, and that in my training of couple therapists is a big topic for the last year or so. And we're getting more and more aware of that need, and that's such a big buzz happening. So I'm really grateful to have you join us today.
Thank you. Thanks for having me.
Why don't you just tell us a little bit about your practice and a little bit about you as we get started here?
Sure. So my background as a therapist began as an individual and couples therapist. I'm an Ackerman Institute alum, and so I was really excited and passionate, and still am, about family systems therapy. But I also have a background in cognitive behavioral therapy as well as psychoanalytic tradition of psychotherapy. And in my first life, I was a modern dancer, a professional dancer and choreographer.
I know when we've chatted before, it's been really fun to talk about that dance piece, because as a couple therapist, and doing trainings for Sue Johnson and emotionally focused therapy, the tango and the couple relationship as a dance is always a really big theme that we use. And so it's, I'm sure you see a lot of similarities too with your couple work and dancing.
Definitely. And also a comfort in, Sue uses it in terms of the balance of communication, power, connection, obviously, and attachment. I also use it in terms of ability to communicate, because as a choreographer, one of the things you have to do, or even as a dancer, is tell another person, you have to move like this, or can we try this lift this way? Can I put my arm over here or over here? And so you really have to have a very nuanced way of talking about movement. And certainly when people come into my practice, they're coming in for sexual issues and they don't have the language.
Yeah, we just aren't used to talking to each other at all. Couples especially, right? Hopefully as therapists, we get familiar with talking. Before we launch in, I just want to say hello to our viewers. We have folks joining us, Sari, I want you to know, from all around the world. They're signing into the chat box. So hello, from Romania, New Zealand, and of course around the United States, from California all the way to the East Coast. And I'm just so glad to have each of you here, and welcome your questions. So as we go along, please do continue to say hello in the chat box and let us know what you're thinking, what your questions are. We'll be much better able to respond to you. We're happy to respond to you and to your questions. So sorry, it's really exciting that we have it's such a great topic and so many people participating live with us.
Welcome. Hi, everyone.
So we've talked a couple of times and recorded a couple of things already together. And it's just been a blast to do things with you. And you're doing some really fun things. At the end of Talk Time today, we'll let people know about some of the things you're doing, because you're also doing some webinars where people can get some training from you from online courses. And so that's really exciting. We'll let people know how to access that when we come up towards the end.
Sure.
So one of the things we talked about was working with men, working especially as from an attachment perspective, thinking about avoidance and men and sexuality. And I think we kind of landed more broad than that, just with men and their concerns when they come into the treatment room. So Sari, I'm always switching that up. Let me have you take that away.
All right. So what I see when people come in, first of all, I see men initiating more when I became a sex therapist. And when I was a couples therapist, I would have, generally, if it was a straight couple, I would have the woman calling me. But once I became certified and was doing primarily sex therapy, where people knew that they could call and talk about sex right off the bat, I found that men were calling more as the initiator. And that in itself, I thought, was very interesting. As a diagnostic thing, as a societal issue, I think men do take responsibility for the sexual piece in their relationships.
Certainly men have a lot of permission around the relationship when it comes to the sex life, right? And initiating sex, or an expectation from society around that. I remember I did a talk show, an online radio and call-in show when I was in New Zealand a few years ago, and the same thing happened. The majority of the folks that were calling in were men, and their first questions had a lot to do, typically had to do with sex. And in the online space, men were really accessing those resources.
Definitely. Well, I also think that they are brought up to feel like they are supposed to fix a problem. And
Yep.
If there's a problem in the sexual realm, it has to do with the way they feel about themselves as men. It refers back to their masculinity and their identity as a man.
So that's one thing you notice kind of right off the bat. And that would be interesting. We could just ask our viewers if you notice that when people are calling. I always am curious which partner makes that phone call for therapy. That's very interesting to know. And so that's kind of an interesting way to think about it, right? Or when the man is the one that calls. Years ago, what would hear is my partner, my wife, said I have to call or else, right? There seemed to be the woman behind it. But more and more, when that call is made, then the presenting problem often has to do with sex, or men are also just beginning to claim more around relationship.
Yeah, I'm wondering about that as well. I also feel like in gay relationships, the man, typically a man who's having a sexual issue with his genitals, with his penis, he's the one who's actually making the initial call. Because he feels, again, it's my property here. It's my problem. I want to fix it, and I want to take responsibility for it.
Mm-hmm. It's just so great when that's the approach. Of course, we know when it comes to relational dynamics, it's not going to be one person in particular we're not looking for fault to begin with. But when someone does say, hey, this is a problem I have, and I'm dealing with this, that it certainly is really helpful when it comes to treatment.
Right. And one of the questions too is I as a trained systems therapist, couples therapist, I always invite their partner in, or I always inquire as to what their intent is if it wasn't stated in the initial phone call when I have an intake call, and some men want to come in by themselves, even if they're partnered, whether they are gay or straight or bi. They want to come in by themselves. And so that to me already says something about how they feel about themselves, perhaps the attachment. There's already, diagnostic stuff going on in that initial phone call.
Yep. Yeah. So as an individual therapist, you're if we're working individually, it's always useful to bring the partner in if people are partnered. As a couple therapist, we're going to probably do that assessment and have some individual time as part of that assessment phase and that initial call. So go ahead, tell us what you do next, what people should be watching out for when it comes to men's sexuality and their concerns.
Well, I listen for threads. And then I inquire about them. I ask people, it's funny, I just had a couple today, and their presenting problem was in frequency. And so they are starting to talk about when he, that she's asking him to initiate more. And he says, well, she asked him, well, when you touched me last night, was that an initiation request for a more sexual experience? Or was it that you were just giving me some comfort? Which was a great question.
Great question.
And he said, maybe it was like a test bubble to see how you would react.
Mm-hmm. Right.
And so I said, and she said, well, you could have asked me, or you could have given me a stronger signal, because I didn't realize what it was. So he thought about it. They were really both very smart, these people. And he's like, I kind of feel I'm really getting all the responsibility here.
Yep.
Right? And I said, well, how does that relate to your role in the relationship and how you see yourself and your narrative within yourself about being a man? Right. So I go straight to it. And he said, well, if I initiate, she turns me down, I'll feel really rejected.
Mm-hmm. Right. So that's such a big part of that relationship piece, isn't it? That sense of I put myself way out there, and then it hurts,
It hurts.
Right. It hurts. And I risk rejection. And if I just test the water, then nobody's on the line, nobody's on the spot.
Right. But then to go further with it, I said, well, what is happening? Well, I actually do a piece around, because I do sexual histories with people. I teach actually how to conduct a sexual history with each individual partner. And so I asked him, well, how does that relate to your adolescence? I said, because I know he's more of an artsy guy. I said, so you were one of those artsy kids. You had some trouble in middle school, didn't you? And he said, yeah. I said, beaten up? Mm-hmm. Taunts? Yep. Pretty bad? He goes, yep. And I said, so when you are rejected or she says no thanks, what happens in your body? And he said, my head goes numb.
All right.
Such a physiological response, right?
Yep.
And I said, when else have you had that physiological response? And he said, in that schoolyard.
Mm-hmm. So you go right to figuring out those blocks for, I guess what you're doing is, I think what I hear you say that you're doing is something about how his identity, what he expects of himself, and then where there's kind of some incongruence between that. Like I feel responsible, but I don't actually put myself out there. And this is some places that end up blocking me. This hurt, this old pain, this hurt from getting rejected, from being taunted. These are ways that makes it difficult for me to show up.
I would agree, but I would go farther, because I think when people are being bullied, it is a trauma.
Mm-hmm. Yep.
But in their acculturation, they're not supposed to think of it even as a trauma, because men are supposed to be tough. So on the one hand, he's being told he should be tough. On the other hand, he's being asked by his wife to be aggressive and not get hurt. And so he's actually trying to figure out all these streams of information around his own narrative, around what it means to be a man.
Mm-hmm.
And they're mixed messages.
And of course, he's going to have some mixed feelings about that will can make things problematic. So let's see, this might be a good time for a question, or there's a question in the chat box that may be an okay time for you to address this. And from Wellington, hi Marion, writes that when men have erection difficulties and it's been a long-standing anxiety challenge, how do you work with that? She says she tends to work more in individual sessions to attend to the psychoed skills and maybe sometimes helping both partners learn relaxation skills.
Yeah, I do that as well. I also do some education with the partner individually. Certainly I do relaxation. I do exercises to help the man gain more comfort when he does lose it, that it's not an all or nothing proposition. But I also do work with his partner, whether he's male or female, whether it's a man or a woman, in kind of coaching them, first of all, on how to be a team player. Because it's much more useful or helpful to work on erectile dysfunction when you're with a partner. If the partner is supportive and understands what you need and is patient. A lot of times the actual dynamic that goes on between partners is the man will say, well, I'll either see him like roll his eyes, like give up on me, or I'll see her looking down and looking really sad, and immediately I feel like a failure or a loser, and she's just, like being pathetic. So I ask to kind of speak to the other partner to make sure that we're all on the same team. And, I ask them, I ask them more individually, I think, what it means to them when they lose it. I'm not really a man. They have like a litany of words. I really ask them to use their words.
About what it means to them.
Yeah.
So you get some way that you can really relate to them and their words. So the anxiety, just erectile dysfunction to begin with. I mean, thank goodness for some of the ED commercials and Viagra and stuff that's tried to normalize some of that, but still there's so much shame, right? And anxiety around erectile dysfunction.
Well, I think that for younger men, I work with urologists, and what's interesting to me is that there's a whole host of young men now who are getting Viagra and Cialis, and they don't have any sort of physical problem. They don't need medication for that. But the doctors have it, right? So they want to give them something as they walk out the door. They aren't sex therapists, so they're not going to teach them, maybe you should learn some relaxation exercises. Maybe you should go see a therapist to find out if there's something going on in your relationship that's turning you off or frightening you or angering you. I mean, right? The relational piece of it.
Yes.
But younger men, I think for a couple of reasons, A, it's there and they can get it. And B, many young men are growing up with porn as their education. So they're seeing this fantasy land of what male sexuality is supposed to look like and what partnered sexuality is supposed to look like. And it can be very intimidating to them if they think like, oh, I'm supposed to last a really long time. Or if I'm not rock hard, right? There are people who obsess about how hard they are. So they have to be like a 9 or a 10 every single time. And that's not our bodies. Our bodies don't respond that way. And so I use actually my dance metaphor there. But I relate it to a guy this way. I say, so did you ever do any sort of athletics when you were younger? Most guys did, but for instance, my client today who didn't, I'll say, "Oh, did you sing?" "Yeah, I sang." Well, I said, "So do you remember that, you woke up some days and you just couldn't get, your speed up, or you couldn't hit the ball, or your voice just couldn't reach a note. You were just not, on?" And they'll say, "Yeah." I said, "Well, you know, that's your body." As a dancer, my motto or my mantra was, you work with what you have that day. And so sometimes if you've drank too much, you didn't get enough sleep, you're stressed out, it's the first time you're with somebody, your body is reacting. And so you have to be more patient,
Mm.
more forgiving. And it's not a performance. That's a huge thing.
Hmm.
I mean, the definition of, a lot of erectile dysfunction is performance anxiety. And I
Right.
say, can we not call it a performance? Your partner's not an audience.
That's such a, so that kind of gets right to one of the crux pieces, I think, of that men's narrative, right? Is I have to fix it and like I have to get it right. It's certainly something I see in couple therapy so frequently, that pressure to perform, to like get it all right.
Right.
Yeah.
I mean, if you think of certain words that are in colloquial jargon, and certainly stand-up comics are always referring to their penises all the time. Penis jokes are like, you know, the always there. But if you think about that, I'm dating myself here, but the classic Seinfeld episode of Master of Your Domain. But if you think that about that word of master and your domain, like get it together, you should be in control.
Mm-hmm. Right. So, Sarah, you mentioned that of course, you're going to be doing a sexual history as a sex therapist, and there's going to be pieces of that as relational therapists. If we're going to help people, and especially men, as we're talking today. I'm just polled our audience with us, and about 75% aren't currently doing a sexual history. So maybe you could just spend a few moments and talk about some of the things that you're asking that would be helpful for couple therapists to start to be aware to begin to ask for those sexual history.
Right. So, I mean, as sex therapists go into up to a lot of detail in a sexual history, but for general couples therapy, they should be really aware of what the expectations were in the family of origin. What did they see growing up? Um, I always say your first sex ed is the home in which you grew up. And most people will say, my parents said nothing to me about sex.
Right.
And I'll say, but education is nonverbal as well as verbal. It's direct as well as indirect. So the jokes you heard in your community, the expectations you heard, if you heard your mother talking on the phone about someone else's kid, and you overheard that, gossip. So you absorb quite a bit in that environment, and you probably aren't even conscious of it. But now that we're talking about it, what do you remember?
Mm. Okay, great. So you'll start really broad with what did they learn in their home, what do they know, what they're kind of aware of, and that will give you at least a starting place to become more specific with them.
Right. And so, some boys learn early on that to be a real man is not to necessarily listen to your wife, to your partner, that you're the one in charge, and in the end, you have to take care of your family. So there's already this sense of this is not an even playing field, right? In cultures where there's a lot of acceptance that a man is going to stray. For instance, I have a client who's Latino community. It was a known thing that his father had a mistress or several,
Yes.
um, and it was just don't ask, don't tell. as long as you don't embarrass the mother and the family, it's accepted. And, the work I'm doing with him is very interesting because, he has friends or cousins who are going on trips to Las Vegas, and it's an accepted thing that they're going to do stuff, and he's expected to uphold the boy code. So I do talk about the boy code. And, first men will look at me like, that's Sue Johnson, like tilting of the head thing. But then when I
dog and recorder.
When I explain that it's the code of entitlement, or you're not to say anything about your friends, and you're not to challenge them or not to talk to them about certain things, and you're supposed to be tough.
Right.
So I asked them about their particular family, and then also about their culture, and also about religion, which is huge.
So the places where they would get the most input about sexuality and how they're going to feel about sexuality in a really close environment, their social environments.
Right.
Okay.
And then I go through their life, basically, and talk about different experiences they've had.
Right.
For instance, some men who are coming in with a sexual issue, younger men, late 20s, early 30s, maybe they've had one relationship of importance, of emotional importance, and the rest of them were more hookups or short dating things.
Casual sex, more in a casual sexual way.
Yeah, and uninvested emotionally. They didn't take an emotional risk. And then they come in because they've met someone they really think is the one, if you will, and they're losing their erection. And so I trace it back to that first relationship. In many cases, they were dumped, or maybe they were cheated upon. And then I go back to, okay, so what does it mean when someone cheats on you? What would guys, what would your friends call it? What would your friends in middle school call it? And then you get the litany of names.
Right.
You're a loser. She took advantage of you. You dropped your guard. You lost control of the whole thing. You were an idiot. To trust her. All that really harsh, like harsh tone to it, all around. And then, you try to link it up with how harsh were the voices at home.
It's also really interesting to ask or to know, did they share those bad experiences with anybody, right? Because very commonly, maybe you're the first person as the therapist who they've revealed some of those stories to.
Correct, right. But I always bring it back to the narrative. So they start seeing it, so that they can choose not to necessarily participate in it. Giving men a choice of how they
want. Sari, or Sari, sorry. I do that constantly. Something's rubbing on your mic. We're just getting some static there, like something may be rubbing on your mic. So I want to just have you double check that.
Okay. Is this better?
Yep. Go ahead.
I lost my place.
Sorry about that.
Well, I always connected back to the narrative and how they're viewing themselves and having a conversation so that they can make choices. That's what we do in therapy, right? We're trying to give people choices on making different decisions going forward.
So you're helping them to bring into more conscious awareness, so that they do have more choice, I guess, is kind of what you're saying. And you're asking enough specific questions that those areas that aren't congruent with their expectation with what's happening, or places that they've been quite hurt in the past, can come to the forefront.
Right. They'll challenge me too. I've had a lot of men from different cultures, Latino, Italian, Irish, um, and they'll just say, yeah, like, right, I'm supposed to do that. What are my buddies going to say?
Mm-hmm. Right.
And I'll say, well, what will they say? They'll say I'm a wimp, that I let her walk all over me, that she's using me, that I've lost my manliness. And I'll say, so there are huge consequences to doing something different.
Yeah. And of course, that if that's the way that they're seeing, maybe they're saying that's what my friends would say, but that's what how they're judging their own experience.
Correct.
Through. So I have a question here from men who are in, so this is a question from the chat box. So it's a man asking the question, says he has a great sex life and both quality and quantity, but would really like for his partner to initiate more sex. He's the one that usually is initiating. And, that he would feel so great and wanted and desired to have his wife initiate, but she doesn't. Any suggestions for how do you help men or help women take more initiation?
Well, I think the first thing is for them to empathize with you, right? So by asking her, well, how does it feel when I initiate or I come on to you? Great, I love it. What do you love about it? Well, I feel desired, I feel sexy, I feel beautiful. It really gives me a sense of self-esteem. I love it. Oh, so, I'd love that too. I actually get really turned on when you would initiate. I'm wondering if you can, now that you understand that I actually have the same feelings, how you feel about it. That's step one, is the empathy, right?
Right.
And then the next step is what might hinder you or, get in your way. And by the way, I've heard this a lot from men. Men, a lot of men love when their partner initiates. I really talk to people about power exchange in relationships in terms of one person being more dominant, one person being more submissive, people taking turns and liking that. And then there's some people who just really like to be submissive. They want to be led. I do think that they can step out of their comfort zone. I think you have to ask them what's in the way.
Mm-hmm. Right. And so I'm imagining that what happens in my office is that many women are now I know this is split because it's on many women's minds, and many women are initiating and men aren't responding. That's a very common problem, right? But low female desire is the most common treatment concern when it comes to sexuality in couples. Mm-hmm. So, many women respond with, well, I can warm up to the idea when you initiate with me, but it's not really on my mind otherwise, or I'm not sure I really feel like it if there isn't that invitation.
Right. That's exactly right. I think it's one of the more common problems that women bring into therapy. So what I would say is, I think it might be on the onus can be on both of you to get you into the door. There are things he can do to get you interested or willing to at least consider starting something up. But what are you doing to turn yourself on? I kind of am pretty challenging to people.
Uh-huh.
And they'll look at me like, what do you mean? And I said, well, what are the things that turn you on? So I have one patient who doesn't like to watch porn, but likes to listen to it. She's very audio focused.
Mm-hmm.
I said, well, when was the last time you listened to some porn? She goes, oh, when am I going to find time to do that? I'm like, okay, well, you're asking him to initiate, but what are you doing to get yourself going? There's this thing that really does it every time for you. What about bringing it in and as part of your weekly diet?
Mm-hmm. Right.
So now she's doing it. So that's part of it too. I think if it's a matter of low desire, I don't feel intrinsic desire, which is what women are complaining about, which is what I call intrinsic horniness. It's like a physiological experience of a thirst or hunger for some sort of sexual experience. I'll say, what are your other ways of getting into the door? For some women, it's reading erotica. For some, it's going to a dance class. Like I've had so many female clients who say, if my husband could just be available after I go to the gym in the morning, we'd have a great sex life. Like, oh, okay, well, can you store it and bring it up later? Great. Can you text him when you're feeling that excitement or, horniness? So he knows that you're thinking of him.
Right.
That's an initiation. I would put that initiation category.
Yep.
It doesn't have to be always the same way, of initiating, like an actual physical thing. It could be through texting. It could be through touching a certain way. But I think you have to figure out what's getting in the way in answer to this gentleman's question.
It also seems that women, I don't know what you'd say about this, but I was thinking of some of my clients that there's, like you said, your client who after the gym, like that there may be point times or little cues, like little initiations, little bids that are just small, and if they're not
being picked up,
and the partner doesn't necessarily even know that they're bids, or they maybe would pick them up, but they're subtle, right? And they're small. And so sometimes it's really helpful to help people decode, that certain little look or that, that gesture that could just go in passing.
Right. And I would add to that many women have expressed that they're somewhat afraid. I mean, there's a whole women's narrative that we're not talking about completely today, right? But that if they start something, they somehow feel like the onus now on them is to complete it, which means that session has to end with penetrative sex. It's like once you're a couple and you're having penetrative sex as part of your repertoire, it always has to end there. And so some women are very ambivalent about starting anything up. They may be in the mood for just like making out because their husband looks cute right there, or their wife is, in the kind of lingerie that she likes to wear. But they may not want to do soup to nuts. And they feel responsible, and they have a whole narrative themselves which goes, don't be a tease.
Yeah.
We have names for girls like that. And they're not real pretty.
Right. And your partner is going to get mad at you, right, if it doesn't end up in penetrative sex.
Right. So that is definitely something I work with all the time with couples.
Mm-hmm. Okay, so this is another question about, and if it gets too far off, because I know you have some things you really want to cover with us today, then we don't have to take all of these questions. But here's one, and again, it's a question about female, I think a little bit, a couple where the woman doesn't like sex and gets anxious to have it, but the man, that's the way that the man feels accepted and wanted and loved. And now they're not having sex because of that conflict. So, an approach for that with them. And would you approach the narrative and the sexual history in sort of a similar fashion with that presenting problem?
I would. Yeah, I think that's actually a good question. I like the fact that, the caller asked, described that the man feels, that's how they feel acceptance. Because I gotta say that men, they don't put it together, and certainly their female partners don't put it together, that when they want to have sex with the person that they love, most times it's to feel an emotional connection.
Yeah.
They can't even articulate it. because
It's,
they
it's, it's so
train.
interesting. I've been studying this research, for years on pornography and different compulsive sexual behavior and different things like that. And I can remember really clearly a study, I'll have to look up the reference, I don't remember the reference, but the study was on men in chat rooms and in porn rooms, going into chat rooms for porn. And they surveyed the men, like what were they looking for when they were there, even though they were just looking, they on the surface were looking for a sexual encounter. But what they said they were really looking for was to feel loved, to find that relationship.
Right. There's another study done by a woman who's a sex educator, I believe now, and she was a stripper for many years, actually. So she's did research on men who go to strip joints. Same thing. They want to talk to somebody,
Yeah.
And feel emotionally okay.
Emotional connection. Yeah.
Right. So as far as the question goes, it depends if the woman is interested in figuring out why she doesn't like sex, and where in the relationship did the contract change. Most marriages, there is an expectation of their contract that they will have sex with one another, and sometimes that changes. And so, is it an aversion? Is she frightened of it? Is it related to some trauma that has never been dealt with? Does she want to deal with it? Given all those kind of questions, which take time to uncover, it's interesting. I've had a case like this where they've been married 15, 18 years. They had 5 kids together. And he came and said, I really want to have sex with my wife. I invited her in. She said, I did it for years to really please him. I really don't enjoy it. And I think I'm done.
Mm-hmm.
Which says something also about the attachment. She goes, I do so many other things for you. I raised your kids. I did this. I converted. I did all this stuff. I think I'm done. So it just sort of ended, and it said something to me also about attachment. And I said, well, do you feel badly for him? Not really.
Mm.
And so I'm getting to the point now of offering them the discussion of, well, what would you say if he took those urges elsewhere versus his masturbating on his own? How would you each feel about that? If you're going to change the contract in the middle of a relationship, and it has something to do with one of the basic expectations you had about this relationship, then it's something to talk about what it would mean to change that. And I do have those conversations. So for this man, I think there's more work to be done as exploring why she doesn't like sex. And did she ever like sex? And is there a problem with the way he's pleasuring her? Because that actually happens too. When I get them into individual sessions, I find out that perhaps the partner is not that sensitive a lover, maybe not that educated, doesn't have a lot of technique. She doesn't know how to tell him that. So there's, I don't want to hurt his feelings. So instead, I'm just going to not be interested. But those people actually have incentive more to do something. There's something else going on with this person, this woman, and we don't really know.
Right. We don't know all of that detail. So that's a great, really interesting way to begin to approach it. But thinking about the men's narrative and how you're describing, skill, sensitivity, maybe finesse in the bedroom, right? There's quite a bit of pressure or performance in that narrative for men. And yet lots of times they really don't know how to help pleasure their partner, or even about their partner's anatomy or desire and arousal patterns as well. Is that something that you're help to address with couples or individuals?
I do. And I think that, in the webinar that I've been working on, giving now, I divide men's narrative into 4 categories: power, which covers like winning and entitlement. Mastery, which has to do with being able to control the situation or control their penis and their erection. Mastery in terms of technique.
Mm-hmm.
The third one would be attachment and fear of loss or rejection. And the last one is independence. So I put it into these 4 categories. And so what you're describing is mastery.
Yep.
I'll use that word. And I'll say, you know, most people think you have to be really good at sex when you get started. Just automatically it should happen because you have the urges. And I'll say, you know, there are a few people out there who just happen to be very gifted. And I'll go back to dance again or sports. And I'll say, when I was coming up, you know, there was that friend of mine who could like take her leg and just like go like this and lift it up to here. And, you know, I would just look at her like, and it didn't take much for her to do that. She just had the natural ability. And I had to work years to get my leg so it would go higher and higher. And this is probably as high as it ever got. And it took years to get there. Now, I'm not saying it will take you years, but the point is it takes practice, just like we have yoga practice, or we have meditation practice. And you have to get some feedback from your partner in order to know what feels good to her or him, for that matter.
Right.
And there are videos that can be very useful, educational videos for people who really don't know their way around genitals.
Yes. So helping people understand arousal points, erogenous zones, response rates, just even kind of knowing what to expect can be so helpful.
Right. And as far as mastery goes in terms of the narrative, many men will avoid arenas in which they're not the best, or they're not expert, or they're not fantastic.
Yep.
So, you know, I'll get, you know, straight couples, and the woman will go, I don't understand. I've asked him to go down on me like so many times, and he just won't do it. I don't get it. And then when I talk to him alone, he's like, well, I'm not quite sure what I'm doing down there. And I'll say, well, have you asked? He's like, no. That would seem weird. So is it easier to avoid than having to ask for help? It's like, it's the old, no, don't stop to ask for directions kind of thing.
Right.
Sometimes women don't even know what would feel good because they don't know their own bodies.
Right.
And I put it back on them to become more of an expert on what feels good to them.
And kind of being willing to explore and give feedback becomes really important. But again, then couples and individually need to be comfortable even having those kind of conversations. So it seems like one of the things that begins to help so much is just having that conversation with a therapist where we can be comfortable talking about it, that they can start to be more comfortable stumbling around and learning some language and having a forum to begin those conversations.
I think you bring up an excellent point because I think therapists aren't used to talking actual words. They have to know anatomy themselves. They have to be comfortable maybe using colloquial words in order to align with a client. So if someone just says, you know, I'm not going to just jerk off next to her. I'll say, well, what does it mean if you would jerk off with her present? Right. So I'm comfortable saying that stuff. A lot of people aren't. But if you want to give permission to your clients to start talking about this subject, you also have to be comfortable.
Can you talk to us for a minute about, Laureen is asking, what's the difference between power and mastery in your model? Yeah.
So with power, I'm talking about what I referred to earlier as power exchange in terms of who's initiating, who's dominant. I'm also talking about, I have to say, somewhat entitlement, which I find, because we live in a patriarchal society, most men, unless they're men of color, um, have more of the upper hand. Although within the community of color, men may also have the power in their communities or homes, and so it affects kind of how they're going to have sex, who's going to get started, when they're going to get started. Power infiltrates many of the aspects of sexuality, whether it's exciting or not, right? Whether it's a turn on or not. So that's what I mean by power. I mean, now that 50 Shades has sort of gone around the world, and people are a little bit more used to hearing the words of like dominant, submissive, I use it in the consulting room to talk about, but that's an extreme example of power exchange. But in any exchange, in an erotic encounter, there's someone leading and someone following. And you're playing with power, and sometimes it's really fun.
Mm-hmm.
Right? But I also use it in terms of power in a societal sense, and in a dynamic in a couple, and where it may not be so welcome, right? Because there is an expectation, an entitlement that men feel that they should have an orgasm that's given to them by their partner. That's how every sexual encounter should end. And so going back to what I said earlier,
Mm-hmm.
I said, well, could you envision what would it be like, or what would it mean to you if maybe you were inside her but you didn't finish, or she started to give you oral sex and then she got too tired, and you started to touch yourself in her presence, and she just lay on you as a way of an alternative way of having a sexual encounter. Well, I would feel like such a loser.
Mm-hmm.
Right? Again, the demeaning nature of not being given to, and that a sexual encounter has to end this way because it reinforces one's power. So that's power, entitlement. Mastery, I think of more as technique.
Yeah.
That you can master not only your physiological response of your own body, but that you have some mastery and technique in making your partner feel good in the way he or she feels, excited or aroused.
So and the other two domains that you talked about, maybe you can run through some questions that help get to each of those domains as well.
Questions that I would ask men?
Uh-huh. Yep.
So, attachment, which you're, an expert in, obviously, Rebecca, are following the threads of attachment in the moment-to-moment tracking of a sexual encounter. So when you took her by the hand from the couch and you were leading her into the bedroom, what were you thinking about? I was thinking that we're going to have sex and it's been a while and I'm going to feel really great. Mm-hmm. And so then when she was lying underneath you and she switched positions and she wanted to be on top, what were you thinking? And I'm afraid that, she's not into me. Maybe she's just using me. Maybe this is just more of a hookup. And then I probe more of the attachment issues within that sexual encounter. And certainly the fear of loss.
Yeah.
If I lose my erection, I have a client who had some erectile issues and we were working on them, and kept feeling like his boyfriend was going to break up with him if he kept losing it in a certain position because he wasn't enough of a man.
Mm-hmm.
We really had to sort of engage in that, kind of question that, what did that relate to in his history, Was it actually true? You know? Um, and in the end, I think he was also just questioning whether he was attached to this guy,
Uh-huh.
because the guy was kind of putting pressure on him to perform. And he didn't like it,
Right.
but he wouldn't admit it to himself right away. So I'll ask those kinds of questions. So let me ask you this. So if you felt like you were hard enough to penetrate him and not lose your erection, then you would feel like he'd be more committed to you as a partner, a long-term partner. Yes. So that sense to me that you're only as good as your last sale.
Mm.
Is
Right.
that how it feels? A little.
Right. Really nice way to get at that kind of deeper fear of how insecure that relationship is experienced.
And then take that template and ask whether it's somewhat reminiscent of something from his upbringing.
Mm-hmm.
And this guy actually came from a very wealthy family, and the father had tons of money, and then he lost it all. And then the parents divorced.
Right.
And his father wasn't really as much in his life anymore.
So really interesting way to take, the successful man theme and how it becomes to overlay right into the sexual relationship.
Yeah. Yeah. And what ended up happening with that guy is that he ended up being able to learn the technique, keep his erection, able to top his partner. And then he started to talk to me about the things he didn't like about his partner and about the relationship. He was able to start figuring out what he didn't like.
Mm-hmm.
After he was like able to like show his, he realized that his partner wasn't that attached as he was.
Right.
Or the way he would want him to be. It was going to be a long-term relationship.
And when there was more safety and that wasn't felt like every performance was potentially the last one, then he was able to be more engaged in the relationship as far as what he liked as well.
Right. Mm-hmm. And the other theme or lens of independence comes up a lot because it comes up with again, this is my problem, I'm going to take care of it myself, or I don't want to hurt her feelings because I would prefer watching the things I like on porn, and there's a certain thing I like to do, but I wouldn't even bring it up with her because it would, she would feel insulted, or she would feel hurt, or she would look upon me with disgust and disdain.
Mm-hmm. Right.
So better I should keep this to myself.
Well, it's great to have those 4 kind of areas of exploration that really get so much to men's identity and then the confusion that they face in their sexual relationship. So we're about out of time here, and I just want to shift to a minute to let people know about the training that you're doing, the webinars that you have available for purchase for training. You have avoidance in long-term couples, treating sexual avoidance in long-term couples. You have one on this sexual narrative and how to listen for that, and which I think you go into much more depth than what we've done today. And then how to conduct a sexual status interview, which really for the audience here with us today sounds pretty important, since about 76 or 78% of folks listening today don't conduct sexual histories.
Right. So sexual status, I'll probably be doing a sexual history webinar as well. Sexual status is a little different than sexual history in that it is asking a couple about their last sexual encounter.
Oh, yeah, thank you.
Tracking format of frame by frame. So it's actually very diagnostic and helpful. And
Yeah,
yes,
so you're really getting to their sexual script in their current relationship in that course.
and the one I just started it actually yesterday, but if people are interested, they can register still, because there are 2 more live webinars, and then you can get the recording of the first one of listening to men's sexual narrative. It happens on Mondays, 1 to 2:30 Eastern Standard Time, and I do go into a lot of detail around the actual quotations taken from actual cases to really unpack what is going on through those lenses that I described, and how to ask questions and how to dig deeper. So you can register at saricooper.com/webinars, another /.
Yep.
So,
I've put that in the chat box, Sari, so it's there available for people, and it just looks like a great value that we can have to be able to, when we attend these live, I guess we can also get the recordings of those, but that you're participating in those courses in a live way initially with folks.
right.
Okay, cool.
Great.
All right, well, thank you very much for joining me and lending your expertise to us today. I really appreciate you and all you're doing to help couples and folks find more happiness and be able to reclaim their sexuality. So thanks so much for being here.
Thank you so much for having me, Rebecca, and thank you all.
All right. Thanks. Bye-bye now.